Okay, good morning, Dr. Judd. How are you today?
Good morning. How are you, Lynn?
I'm doing good, thank you. So over the last several weeks, there's been a lot going on with COVID-19, and we have had to adapt and make a lot of changes at Crystal Run Healthcare. One of those changes that we've made are implementing telehealth video visits. So today I just wanted to talk to you a little bit about what it is you're able to do as a bariatric physician. What is it you're able to do on the telehealth visit with your patients? So just a little background on you there. So for our viewers, Dr. Judd is a fellowship trained bariatric surgeon, and he sees patients here in our Middletown office as well as in Rock Hill. So today, Dr. Judd, just wanted to talk to you about all of that. We have seen that COVID-19 has had some additional impacts on those patients that are obese and morbidly obese. What can you tell us about that?
So recent literature around the world, as well as the CDC, states that obesity is a major risk factor for complications in COVID-19. In fact, patients with a body mass index greater than 40 had worse outcomes. Patients who are younger than 60 and obese had a 2 to 3 times more likely chance of being admitted to the hospital, and fatality was 3 times higher in the obese population than it is in the non-obese population. So those numbers are staggering. The obesity population is really getting hit hard by COVID-19.
Right. So for someone struggling with obesity, what would you recommend during this time to help prevent some of those outcomes in the future?
Well, I think now is an even better time to consider the weight loss program at Crystal Run. We offer surgical options and we offer non-surgical medical options to help people get that weight down appropriately.
Mm-hmm. Okay. So for a patient that's just getting started on their weight loss journey, what's the first step as far as a visit goes?
Well, you can set up a telehealth appointment with one of our doctors or nurse practitioners. It's a very simple way to get in to see a doctor right away. We'll ask you basic questions and discuss the options that are best for you.
Okay, great. And then how do you determine if a patient is a candidate for a bariatric surgery?
Well, we take each patient as a whole. We determine whether they're a good candidate based on medical problems, medications they may be taking, past surgeries that they've had, body mass index, which is what the National Institute of Health criteria are based on, and then we formulate a plan based on those findings.
Right, right. And, so if a patient decides that they do want to have a telehealth appointment with you, what can they expect during that visit?
Well, you're going to meet directly with a weight loss professional who can answer all of your questions and help guide you in the proper direction, whether it be surgery or medical management.
Any tips on how a patient can successfully plan for a telehealth appointment with you? Is there anything they need to have on hand? Any information they should have ahead of time that you'll be asking them?
First thing we're going to do is ask them to download the Zoom app. That's how we get in touch with people, social distancing. So we'll ask you to download the Zoom app. It's actually quite simple. During the meeting and before, we'll walk you through it to turn on your audio, and then we'll ask you to take an accurate height and a weight. An accurate height and a weight is what helps me determine the body mass index to realize whether a patient is a candidate for surgery or not.
Right, right. Great. So obviously right now, during New York pause, a lot of elective surgeries, or many or most elective surgeries have been put on hold. So a lot of people may not even be thinking about, bariatric surgery or a weight loss program as an option, because they may be thinking, well, there's no way I can have surgery anytime soon. But really there's a journey before, from the consult point to even having surgery. So what does that journey look like for a patient?
Absolutely. The program itself is multi-specialty. You're going to see a lot of medical doctors, a lot of professionals to determine, number one, are you healthy enough to have an operation? And number two, we need to teach these patients how to eat properly, how to exercise, what to expect before, during, and after. And we also have to understand the insurance requirements. So it could take up to 4 to 6 months to get through this program based on your insurance. So it doesn't happen immediately. We are going to hopefully start elective surgery in the near future, but most patients have to go through a process that can take up to 3 to 6 months. So it's not immediate.
Right, right. So really now would be an ideal time for somebody that is thinking about that to really get started on that journey.
Absolutely, especially before, if a second round of COVID comes, great opportunity now to get healthy, lose some of that weight, decrease your risks for future problems with COVID.
Okay, great. And so while we're just talking about that, what are the different types of surgical procedures and any other things that you offer as part of the surgical weight loss program at Crystal Run Healthcare?
Surgical weight loss, we offer 3 procedures. We offer the laparoscopic adjustable gastric band, we offer the Roux-en-Y gastric bypass, and we offer the sleeve gastrectomy. You might be able to see them behind me on the wall. Those are the 3 procedures we offer here at Crystal Run, as well as pharmacotherapy or medical management.
Okay, great, great. All right. Is there anything else that you would like, patients to know that are thinking about having a surgical procedure, thinking about weight loss, or even just hesitant to schedule a telehealth visit?
Well, probably the most important thing I can tell you is that obese patients have a very high risk of developing medical comorbidities, high blood pressure, diabetes, obstructive sleep apnea. It's proven to reduce lifespan. And most recently, we're finding that if you're an obese individual, you're likely going to have a higher risk of having complications with a COVID pandemic and problems with COVID. That's the biggest thing we could tell you right now is COVID is really, really taking its toll on the obesity population.
Right, right. So it sounds like now is the best time than ever to really, kind of put your health at the forefront and start to really look at, lifestyle, diet, modification, and really think about, what those next steps would be. So reaching out to someone like Dr. Judd would be a great first step. And if anybody would like to make an appointment with Dr. Judd or any of the other surgeons or specialists at Crystal Run Healthcare, you can do that by visiting www.crystalrunhealthcare.com/telehealth to schedule a telehealth visit. Dr. Judd, thank you so much for taking the time to talk to us today. We hope that you continue to stay safe and healthy, and we look forward to getting back to somewhat of a normal life sometime soon. It was great to see you.
All right, thanks, Lynn. Appreciate it.
Take care.